We just keep talking about an array of things. All right. Hello, Light It Up TV family. This is your host, Cheryl. Welcome to another episode of Talk About It Tuesday. Hi, Michelle. You are here. Thank you so much for joining us. And as always, listen, as you get in, say hello. Let me know who's here. And then also go ahead and share it out. Go ahead and share this video out to let everyone know we are live. I'm super excited as always because our episodes are covering so many different topics. And tonight we have another great topic with some wonderful guests that are on that have been longtime friends of mine, and they are doctors in chiropractic care. And so they'll be joining us in a few minutes. So let's go ahead and share it out. Let's share this video out. Let me know when you join us. Let me know. I'm going to go ahead and share it out. Hello, Denise. Thank you so much. Thank you so much for joining. I have my support team here. Thank you all so much. Go ahead and share this video out. Let people know we are live. Welcome to this episode of Talk About It Tuesday. It's going to be very good because, again, as I shared in my post, this episode may be something that can help you or another family member or someone that you know. So that's why it's important to just share this out, share this information out. All right, so we are live, and we normally give about 3 minutes to let everyone join in. Okay, let everyone join in with us. Okay. If you are joining, let me know who you are. If you are joining, let me know who you are. Say hello to me. Say hello to me. All right, we give about 1 more minute. It always takes a few minutes for everyone's social media to register. Say hello to us if you're just joining. We are live. All right, so I want to remind everyone that our mission for Talk About It Tuesday is for us to have some real discussions about the challenges or topics that surround our kindergarten through 5th grade, our elementary age children, and to give them a voice so that they can use their voices. Okay, that's what the mission of Light It Up is, to teach children to use their voice so that they can impact their schools, their families, and their communities. And we are going to be having some children on pretty soon. So continue to be on the lookout for that. All right, it is now 7:05 and we are ready to get started. Listen, we are going to be talking about, our topic tonight is children and chiropractic care. And we're going to spotlight juvenile arthritis. Okay. July is one of the awarenesses in July is Juvenile Arthritis Month. Okay. So we will spotlight that towards the end, but we're definitely going to be taking a good dive into children and chiropractic care. And so we have none other than our doctors from Life Expression Health and Wellness Center. They can go ahead and join us now. Yeah. Awesome. Hello, docs. How are you?
Great.
We have Dr. Stembridge and Dr. Roberson in the house. Oh my goodness. It is such a blessing for you all to be here and to take time out of your much busy schedule after you've already worked the full day to be here on the podcast. So I think we've known each other for quite some time. Quite some time. And listen, I'm going to put out there, you all, before we get into that, they're going to tell us a little bit about themselves. But those are my personal doctors at Life Expressions Health and Wellness Center. And I just want to say that they have done wonders for me when I couldn't walk, where I was with dresses on, wearing knee braces, and that wasn't cute at all. It wasn't cute, but now I don't have to wear any of that. So thank you all. They're anointed hands. So we're going to go ahead and jump right on in. Audience, I want to say that if you have any questions while we are here, go ahead. And as you're thinking, even if you're thinking now, like, oh, you know what? I had a question because I saw the topic. Go ahead and start putting your questions in the chat. All right, the docs. That's why they're here. That is why they are here. Okay. So, can you tell us a little bit about yourself and your practice? And yeah, just let's let us get to know you all a little bit.
Sure. Good evening, everyone. My name is Dr. Lawana Stembridge. And I'm Dr. Tawana Roberson, and obviously we're twin sisters. Yes. We have been practicing chiropractic for 16 years.
Wow.
Just recently went out on opened our private practice about 3 or 4 years ago.
Mhm.
Um, I guess it's just easier to say because we're twins. We're 42 years old. 16 years. We got married on the same day.
Oh my gosh, I didn't know that.
Yes, we got married.
Okay, okay.
I have a wonderful husband and two beautiful children, and
Yes.
I love people. I love taking
Mhm.
care of people. It's just something that I've always liked to do. I like to have fun. I
Mhm.
love fragrances. That is my outside job. If anybody
Yes.
works fragrances, hit me up. I know it's
Uh-huh.
true, but yeah, that's pretty much. Think about me, right? Did I leave anything out? Yeah, I think that's it.
Wow, I learned something new. I did not know that you all got married on the same day. Girl, these lights. Ooh, child. I did not know you all got married on the same day.
It was
Wow.
wonderful. It was
It was a double wedding?
It was.
That's
Yeah.
amazing. All right. That's wonderful.
Yeah,
Learn something new tonight. All right.
absolutely.
Dr.
Dot
Robinson.
com. So yeah, she pretty much hit everything, but
Mhm,
same thing. 42 years old, been
mhm,
practicing for 16 years, and as well have an amazing husband and support system and three
mhm.
children, 25, 13, and 10, and
Wow.
absolutely love what I do. I love chiropractic. I love everything health and wellness. I love
Mhm,
herb and
mhm.
supplementation.
Yes.
I just love functional medicine. I love that
Mhm,
we have been able to learn, how God has created us. We can read a
mhm.
Bible, but just to go and see how bodies function and how
Yeah.
systems function and how everything kind of goes together. You
Mhm,
can't
mhm.
see the other. It's just been such an amazing journey for me. So I am so delighted. Thank you again for having us on the podcast today. So we're excited. We're excited.
Yes, yes. Thank you all so much. And I know that when anyone that comes to y'all practice, they can definitely tell that you all love people, that you all love people and you love what you do. All right, so we're going to jump on in. All right. So our topic tonight, as we talked about, is children and chiropractic care. And we will be spotlighting juvenile arthritis towards the end of this episode. All right. So a lot of people may think that chiropractic care is just for children that play sports. But what I've learned from as I was doing my research and from you all talking to you all that is not true. Am I right? Okay.
Absolutely.
So I want to ask the audience before I'm going to ask you all a question, but I want to ask the audience: has your child ever received chiropractic care, or any child that you know have they ever received chiropractic care? And if so, for what? All right. I want to ask our audience: has your child or any child that you know ever received chiropractic care? And if so, let me know what was the reason that they received chiropractic care. Okay. All right. So let me know. Sometimes it takes a little bit to register. So let me know. Tell me yes, no, if you haven't, we're talking about when I say child. Okay, we know that we have grandparents on here, we have moms, aunties on here, so let us know. Okay, if you're just joining us, please say hello, let us know who you are. All right, docs,
Yes. Yes.
question for you is, How early can a child begin receiving chiropractic care?
Out of the womb.
Shut your mouth.
Out of the womb. Both of our children, we can say this, we can testify. Both of our children have been checked chiropractically right out of the womb. And the reason being is the birthing process can be a little traumatic. I mean, the baby,
Mm-hmm.
oh my gosh, you pulled my head or this hurt, so it
Mm-hmm.
where it's the natural bone setting process, but everyone doesn't get a chance to experience that. Hence, my sister and I,
Uh-huh.
mommy Sharon, we both had C-sections. So when I had Jonathan, it was an emergency C-section. My sister checked him. Okay,
Okay.
to make sure.
So I want to make sure I'm hearing what you're saying. When
Yes.
you had the emergency C-section, Dr. Rob checked him when?
Oh, as soon as my husband brought him out, he brought him out, and I was the first person to hold him. I immediately checked him out. I'll say this, and I'm so
Wow.
asked that question, like Dr. Stembridge just said, the birthing process is so very traumatic, and there are so many underlying conditions, disorders that children, I wouldn't say acquire, but they acquire during birth that
Mm-hmm.
go missing, they go under the radar, they go
Mhm.
missing because typically a child is going to get a physical or a medical check probably 4 days to 7 days of birth. They take
Uh-huh.
in, and they're checking the babies out, they're checking for stool, they're checking for urine,
Right, right.
eggs, and they're checking their joints and they're checking their arms, but they're really and reflexes. And sometimes the reflexes will tell you whether there's been some type of mishap or not, but even those things can get mishandled as well. So getting that child, and I would say, let's say they get in their spines, checked and not so much so adjusted, because every child that is birthed and we check them, they don't necessarily need to be adjusted, but it is very important to get your child checked at the point of delivery. It's important.
Wow. This is, I'm in awe
Mm-hmm.
because I've never heard this before. Now I see Denise Pinkney Williams. She said, yes, my oldest son broke his wrist during his high school football practice. Okay. Yes. Denise, did you know, Michelle, Denise, any of our other viewers, were you all aware that children could receive chiropractic care out of the womb? Like when they're first born? What are you looking for, Doc? What are you all when a child is first born, and when you check Dr. Stem's baby, what are you looking for? What is it that why is that important, and what are you looking for?
I'm so glad you asked that question. That is very important. So, if anything, we're looking for anything that is going to affect the child neurologically. So, we are checking their spine, but we're looking at reflexes, we're checking their neck, we're looking at their backs, we're looking at if
Wow.
deformities that we may think that could be of a concern. Sometimes children can be born with spots on their spine, or just little pimples, and that can be an indication of something going on. So I'm checking for reflexes. I'm checking the spine as well. And so we're doing those things that a medical physician would do, but we're just doing it a lot earlier, and we're being a little bit more intentional about it. Like we're checking
Mm-hmm.
in clavicles. So
Uh-huh.
here, a lot of children have injuries to their shoulders and their collarbones during the birthing process. And so if you catch those things early,
Uh-huh.
so they can recover and have a better recovery.
I just text somebody that I know is expecting, tell them, look, get on here so you can get this information.
And the other thing, it just depends on how mom is carrying the child. I'll say
Mm-hmm.
for myself, because I always have to go back to personal experience.
Uh-huh.
4'11", pretty petite woman, and both of our babies, well, both of our pregnancies, our babies were large. So think about it.
Mm.
I don't have enough space. How does that affect your child?
Wow.
I mean, you have to kind of think about it. Although their bones are not solidified and they're not hard and fused, they're flexible like that for a reason. But
Uh-huh.
still, you want to make sure that in the cramping space that
Uh-huh.
able to just kind of develop properly and move properly. Because another thing that we also look for is mobility in the joints and stuff like that as well.
Mm.
It all depends upon how you carry the child. Another thing that we as chiropractors can be certified in is Webster technique, and that is a technique that allows a child to move from a breech position, and it's not an invasive process. Right. That is something that we can get certified in.
Wow. So that is actually while the baby is still inside
The
of
baby is inside. I actually had a patient, and you can go on my Facebook account. I didn't even know her child was breech. She never disclosed it to me. I just, she was coming in for chiropractic care because she was having some sciatic pain.
So let me stop. So expecting mothers, can they get chiropractic care, and that will not harm them or the baby?
Absolutely not. And when I was doing her exam, I felt some things going on with her pelvis, and I was doing some things with her pelvic ligaments and things of that nature, not even knowing her baby was breech. I had no clue. So when she did her testimony about how we were able to help her in the office, and she shared how her baby turned into the correct position, I was like, I did not even know that. So, it is really good expecting moms to get their adjustments as well, because your body is having to make accommodations for another human being.
Yeah.
There's a lot of pressure.
And that, because you hear expecting mothers talk about their back, right? Their back all the time, like, because I guess the pressure with the back, everything is getting heavier. Now, up through what I see we have some comments. So up through what, I guess, what what part of what I'm saying, pregnancy can they receive it? Is it up?
They come the up until time. They have the baby. From the time of conception up until you have the child, there are certain things that we're not able to do. Yes. So there's a protocol for for things that we don't do on a mom when she's in her first trimester. Hold on, got a few more weeks. So we do things like taping, so we do other modalities that are going to help the mom be a lot bit more comfortable until we get to that stage where we can do a lot more invasive.
Wow. This is so good. Oh my goodness. We were talking about, listen, if you were just joining us, we are talking about children and chiropractic care. And oh my gosh, I'm learning so much right now, because I knew that there was a possibility that you all can see, because I remember when my daughter was expecting and you all said, hey, after she gets, this point, then we'll be able to do I guess the other stuff. Don't let me get the name it, but we'll be able to do some other modalities with her, and because she was having some pain, but I had no idea that from the time of conception to the time of birth. Listen, has your child, okay, so I saw Denise said that. Anyone else, has your child ever received chiropractic care of any kind? If so, let us know for what. I see Denise says she did not know at all that, she says, wow, that you could, that they could receive chiropractic care when they're born, right after birth. Michelle says, no, I wasn't aware of that. I'm going to share the info with expectant moms. Yes, Michelle, thanks for this valuable information. It really is, because I had no idea of that. And then they said they're checked in for things that could affect them. I guess you said neurologically. Is that right? Yeah. And that's so important, because we know that neurologically it affects everything else. Am I right?
That's correct.
Okay. Okay. So I see Michelle said, okay, she said yes for back pain. Connie said, I know someone whose baby was offered chiropractic care to help with indigestion issues.
Absolutely.
Wow.
And I will say this, going back to a mom who is expecting, every case is going to be different. There are some moms who have medical issues where they can't even leave out of the house, right? So do a house call, or some moms who have a gestational diabetes, or they develop hypertension when they're you have to be very careful, but it's also really good because the root cause or the connection could be coming from their spine. You just never know.
Wow. So
And
listen, but she just said indigestion issues.
absolutely.
Absolutely.
So, what we've seen with
Absolutely.
babies, sometimes when they have projectile vomiting, which means that they have some sort of reflux going on, when they're that small like that, their nervous system is hypersensitive, meaning the treatment and the care that we give them, they respond very quickly because
Absolutely.
Wow.
it is new. So, if babies are having issues sleeping,
Colic.
reflux,
Yep.
yeah, I mean, chiropractic care does help
Yeah.
to alleviate those things.
Wow.
And I hope
As
I'm
they
not,
develop ear infections.
yeah, getting ahead of myself. But I was
Yeah.
going to say,
No, that's good. That's good because that was one of the questions I had on there. What
Yeah.
are some of the things that you all could actually help chiropractic care can actually help children with? So you all said sleep.
yes,
yeah.
Oh
colic,
yes, Michelle said hand raised to making house calls when
yeah,
you have doctors that care.
yeah, yeah.
Okay. Now listen, don't just be calling thinking they coming for anything now. But if this is a case where you need them, they will, they just share that they will do that because they know that some mothers are not. My daughter was on bed rest for like almost the rest of that pregnancy. That's how her pregnancy was. Yeah. And so some people are, just their pregnancies are different. Every pregnancy is different. So you all said chiropractic care. That's what I'm saying, Michelle. Ear infections,
Mm-hmm.
sleep.
Mm-hmm.
What else did you all say? Colic.
Yep.
Just if they fussy, we have one patient. It was so funny because her baby got checked. She's a patient of ours, and she brought the baby in, and we were like loving on the baby, like, oh, and we're feeling, seeing what's going on. So she sent the message. She was like, "Did you adjust my baby?" And I said, "Well, I checked her." And she was like, she slept the whole ride home. She's normally fussy.
Yeah.
Da, da, da. She
This
doesn't
is
like the
true.
car rides.
Mhm.
And so now, that's just something
What?
she's able to say, hey,
Yeah.
if you have a baby that's fussy in the car, like get them checked. They cannot.
So that's what I was going to say.
They can't.
That is the one thing that just blew my mind because I remember with my grandbaby and she would fuss, 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 cry, cry, cry. And you all said she probably needs an adjustment.
Mm-hmm.
She was very colicky, a little
Mhm.
gassy, just
Mhm.
uncomfortable.
Yeah.
And it helped.
Wow.
Really beneficial to them because again, they can't verbalize what's going on.
Mhm.
But we can also be kind of like that liaison to help to say, you know what,
We think this is going
we
on.
think this
Yeah.
may be going on, or we may get.
Wow. So in my mind, I'm trying to wrap my head around the correlation. Now, in layman's term, because I know there's a doctor's term. So when we're talking about a baby that maybe can't sleep or in the car seat, what is going on what are you all, I guess, adjusting, or what are you all checking to know that if I do this, this is going to relieve? What is it that you all are looking for with that baby? If you don't mind me asking.
Yeah, no, this is good.
Mhm.
Different parts of our spinal cord correlate with different parts of our body.
Mhm.
So, based upon the symptomology that the parent is saying, we know exactly where to go. So it's just, you have to be trained in order to know, like if my baby is colicky and fussy, you know exactly where to go to the spine to address the situation.
Like gut issue.
Wow.
Or if they're like motion sickness and things like that, they may not know that, but that's ear stuff going on. So we know to check the upper cervical, specifically C1 and C2.
Yeah.
Because they can't say, ooh, I'm dizzy in the car.
Right.
Yeah.
Right.
Our feet, I want to be held.
Exactly.
So we know if mom is saying, hey, the baby's fussy in the car, we're like, okay, let's make sure there's not too much pressure with the ear. Because we hear with our ears. Our ears are a sensory organ, but it also deals with equilibrium. And a lot of people don't think about that.
Right.
Babies, they're laying back drinking milk. Right. That's fluid. It doesn't always go straight down. Sometimes it comes up. It's just a lot.
So many different. So what I hear you all saying is that I want to make sure, based on whatever symptoms that the parent, guardian, adult is saying, there's a what did you say? A nerve, or what is it? What did you say?
There's a level.
There's something that connects to that
Absolutely.
is for everything in our body.
Yes, there are spinal nerves that exit off of the
Spinal
spine
nerves. That's what you.
that innervates tissues, organs.
Even from the time when and so even you can identify that those connections, those spinal nerves to that baby, that child,
Yes.
even from the time. This is amazing.
Beautiful.
This is amazing.
It is a beautiful process. And along the way, I mean, there's some really good research out there with pediatric and chiropractic. Absolutely. School, we did tons of research. We were involved in just pediatric research, but allergies and chiropractic, infertility and chiropractic, ADHD, which affects children, in chiropractic. There's so much research that goes out there, but I will never forget when we were doing research with.
Amazing.
Do you remember that? Sudden infant death syndrome, and how they don't advise for babies to go to sleep and turn their neck, because what we found in our research is when the babies would have atlas laterality, meaning the bone is
I'm about to say, break that down for me.
It's already moved to that side, already to the left or to the right. So if the baby's atlas has moved right and they go to sleep, turn their head to the right, it's cutting off blood flow to the brain. Right. And that's why those children were, from what we found in our research, were passing away, because it's just like anyone who, older person who had a stroke. Right. No oxygen to the brain, but by way of a clot or something like that. So where, because their little vessels and stuff is so small, and it's not room for anything, inflammation, anything like that. And coupling with that, if the birth was traumatic, things of that, there's just so many factors. So that's what personally intrigued me to become certified with pediatrics and it's a chiropractic, because that is a small sector that kind of gets overlooked. Absolutely. So
wow, this is so amazing. Listen, I see okay, we have somebody from Instagram, T-Gale 2020. She said, I'm a 47-year-old woman and a police officer. I go to my sisters regularly to get adjustments. Best thing ever. Yes, it truly is, T-Gale. It truly is. Listen, I come out feeling like a new person. I'm for real. Thank you for sharing that. Thank you. Go ahead. Huh?
I said, and her baby was getting checked too. We were pediatric patients.
Absolutely.
Really? Okay, I have a question about that. Audience, I want to know, have you all ever heard this information before? I see we have some comments and questions from Charity. Okay. Have you all ever heard any of this information before, from sleep and colic and with the car and with riding in the cars? Let me know. Have you heard this? This is amazing. It is amazing what you all are sharing that chiropractic care can help with. Let's go to Charity's comment.
Here she is.
And so Charity said, I was, but the times that I visited Dr. Rob, she knew exactly where I was hurting before I could even say it. I know, Charity. I don't have to say anything. I don't have to say anything. She tells me, oh, you're hurting here. Oh, yep, you're hurting. She said, me and Caleb got to make an appointment ASAP.
Y'all come on down.
Listen. And she has a question. What about congestion in babies?
Oh, okay. So with that, that's more of a remedy where we would say, okay, let's check the baby just to make sure everything is flowing properly. There are no blockage, but typically with congestion, it's just kind of like get a humidifier, oils, that nature.
It's more of a allergen.
Yeah. Gotcha. Good. That's good. Okay, so Charity, you heard that is more. So that's not neurologically. That is more of an allergen. That's good to know. At Genesis said, I'm a witness. My baby loves getting adjusted. Awesome. Listen, and how old? Can you ask how old is their baby? You all know? That person, how old is this person's baby?
5 months, 4 or 5 months.
Really?
That's our car seat baby.
Yeah.
That I was telling you about.
That's the car seat baby.
That's my car seat baby. Well, that's our car seat baby.
Right.
Yeah.
Oh my gosh. Michelle said, no, never heard of this before. Denise said, this is great information. I've never heard of this. Simply amazing. I know. Charity said, gotcha. Okay, about the congestion. And Lou says, it's good to know this. It is. This is really good to know. Okay. Let's go now. Before I did read something, I guess is that along the same lines of immune system that chiropractic care can. Listen, you all, out in my research, I saw something that says it has been found that children who see a pediatric chiropractor regularly get fewer colds than those who've never seen one. Explain that. Oh, who says, man, I hate I missed this. That listen, Ebony Hall, you can go back because there is some great information that they shared about chiropractic care from the time of conception until the time of delivery on up. So yes, go back and listen to the replay. So what is that what is that correlation? Like that is amazing. Immune system? What is going on there? What are y'all looking at there?
So think about it like this. When a child is in utero and they're an embryo, there are certain things that are going to happen from a cellular level. Being the brain, the bones, everything. It is such a beautiful process. So if you think of a tree, when that child is an embryo, they kind of look like a stalk, right? That's
right.
The spinal cord. And then the brain has become everything else. It becomes into the nervous system. So this is how your organs skull forms, your fingers, all that good stuff.
Right.
Once the child is then born, the nervous system, right? It's almost like it goes through a quiet sleep phase. So this is how back in the day they would say you can't take that baby outside because that get a cold. Well, it's not that the baby is getting a cold, it's just been protected for so long inside of it needs to create its own immunity. So by getting their spine checked, it helps the nervous system to then help the immune system to become stronger. Right.
Wow, to develop their own little immune. Wow. Michelle says, say what? I know, Michelle, I'm in awe.
Immunity, immunity has so many sectors because there is immunity that babies can get from mom. Absolutely. That's passive immunity. Yep, correct. Isn't that correct? If I'm not, it's okay. Passive immunity is where baby can get antibodies from mom's breast milk. Okay.
I've heard that.
Dr. Rob was saying just allows the nervous system to then help the immune system to better. Meaning, if the child is exposed to something, it allows it to have more of an adaptive immunity. Absolutely. Where you have memory to like, oh, I remember you from last time. I'm going again. Yeah. If
the neurological aspect of that.
Remember how I fought you off? We'll try this. Yes. No. So the chiropractic adjustments does allow for the nervous system to work at maximal capacity. Allow the immune system to work at maximal capacity.
Wow. That when I read that, I was just like,
so wow. Going back to Charity's question. So I'm glad we talked about that with congestion. Should she bring the baby in to get adjusted? Absolutely. Will be congested like everybody else? Maybe so, but may not be as long. Or they develop a better immunity.
That's good. Like she said, the neurological part of it remembers this is how I fought it off, and it makes it, I guess, more alive and like you said, high. What was the word you said? It is what did you say? What's the terminology?
It gives it adaptive memory.
That's pretty cool.
Adapts to what it has been affected by and associated to, and say, I got your number, try it again.
Right. That is so, because it's the memory that is connected with the brain. Man, you all listen. This is amazing. This is amazing. Okay. Starborn, thank you so much for joining. She said, this is information I wish I had with my first grandchild. I know, D, I know. Her digestive and stomach issues may have been a little more manageable and less painful for her. Yes, this is our Carter's other grandmama. Yes, D. I was thinking about that as we were talking. That's why I text you. I was like, join in because this was some really good information. I had no D. They said from the time, I don't know if you heard that, from the time of conception all the way through to right after they're born, they can check and make sure that things are in place. Now, I guess with digestive, that's the same thing as what you all, that person that talked about with that, Connie, that talked about the indigestion, right? That getting those things in place. Wow. And the car rides. I remember that how she was with the car rides as well. Okay. So, we talked about that. What type of treatment are you giving a child for the better immune system? Now, do you all see a lot of children now? And so, what are like some of the most common things that you are treating children for now?
We do see a lot of children. Most
in
of
what age range?
I mean, from months.
Okay.
To, what age is adults now? 17, 18?
Yeah. 18.
So just an array. Yeah. But there is a sweet spot where we get a lot of pediatric referrals from a physical therapist here and actually occupational therapist as well. I believe their business is called
It's All Fun Therapy.
It's All Fun Therapy.
Okay.
Shout out to It's All Fun Therapy.
Yes, they refer a lot of babies to us if the children are not crawling, and they think
Stop.
Okay.
Yeah.
If children are not crawling,
if they're not sitting up straight, if they are not walking, properly, or walking at all, they refer them to us. And I mean,
one adjustment,
and they're running. We had a set of twins. One baby was not crawling or sitting up. One baby was sitting up. And they came into us for a total, I think, of 3 adjustments. And the mom was like, I don't know what to do. I have to like pin them in now, so because they're all over the place. So
how old were they?
They were 12 months at the time.
Oh, 1 or 2, something like that.
They were 12 months.
Wow.
Yes, that's right. Yet. They were 12 months old.
Just turned 12
months.
Yeah.
So this is okay. So have you ever heard of chiropractic care for crawling or walking, for helping your baby to crawl or walk? This is new information to me, y'all. I'm not. This is just. I know Denise said, "Oh my, amazing!" I know. Yes, it is, Denise, and I'm just in awe. I knew that chiropractic care, how beneficial it was for adults, because I know how I feel going in. Like I can tell, like I have to get an adjustment. I need to get like I can tell, I can just tell. But I never knew of all of these things, you all. This is such good. You all share this information out. Share this information out. Yes, Christina, this is so cool and helpful. Share this information out, because I guarantee you this is information that will help some parent, grandparent, auntie, uncle, somebody. Share it out. Cousin. Okay. So what are you looking for if someone, and how can you tell us, how did that baby get to you all to be seen for, did the mom just say, oh, my baby not crawling or walking, I'm going to take them to chiropractic care? Like, how did they get to you all to say this could be a chiropractic care issue because they're not crawling or walking?
Referral.
At 12 months.
Honestly, because of the lack of knowledge, they are mostly referred from a licensed physical therapist and a licensed occupational therapist, because they are already going to them for musculoskeletal things. Meaning they're working or they're working on strength, but they need us to hit the joint mobility aspect of it. If a joint is fixated and is stuck, they're working on the muscular aspect of it, but again, the children's bodies are so hypersensitive. There is, I'm trying to remember. I think it's, I don't know what track. I don't know if it's the spinal thalamic tract, because I'm getting a little neuro on you guys. But there are
it's spinal thalamic
tract. There are things in our brain that gives us the ability to sense.
I think spinal thalamic, yeah.
Things, meaning if I close my eyes, I know I'm touching my nose. That's a track in the brain, right? So if a baby's pelvis is rotated and it's stuck, their brain knows like, hey, it's stuck. Am I gonna walk sideways? No. So the baby's like, I don't feel comfortable. The steps, it doesn't feel natural to them. So they're not going to do it.
That's exactly right.
The same track that if you are sleeping, and you don't know that you're moving forward, right? But your body has a sense to be able to know that it's moving, and it does what? You sit up, like,
yep. And you do that. Yeah.
That's the same track that to know, like, okay, my steps, they're not going to be correct. So
I'm just not going to do it at all.
10 times out of 10, the baby is not going to walk, because their knows it's not equal, it's not balanced, and so they're not going to take the step because their body knows it. Yeah, this walk is going to be a little off.
Yeah.
Wow.
They bring the babies into us, we'll get a quick pelvic adjustment, and the parents are like, oh my goodness, they're walking now, or they're crawling.
Yeah.
Just things like that, you know.
And I like to add, I would say for me, just by observation, the first, I would say, clinical sign of a child that has some type of misalignment that's been gone undiagnosed is failed tummy time. So when you put that child on tummy time and they get to wailing and screaming and hollering like this hurts, I'm uncomfortable. Doesn't mean that they're necessarily in pain, but it also means that they're uncomfortable and that it doesn't feel natural to them.
Yes.
This doesn't feel right. So
really?
Absolutely. Yeah.
Wow.
So if you can't lie your baby on their belly and they can't look up and like do little things like that without being too fussy, you know, you may want to get professional help. You may want to call a chiropractor, you know.
Oh, that's why that was my other question. Can somebody just, being that they've heard this now, right? And if they notice that, hey, my child, just what you said, when I lay them on their tummy, I heard you on the podcast, and my child does just what you say. When I lay them on their tummy, it's like they get to screaming, they get to crying. Can a parent just pick up the phone and say, hey, I want to make an appointment for a pediatric visit for my 9-month-old? Can they do that, or do they have to get a referral? That's what Charity want to know. How do we book our appointments?
No, you just make an appointment. But what happens at that time is they will get assessed just as an adult. So we will do our orthopedic and neurological exams. And if we feel like there needs to be a co-regulation with the physical therapist and the occupational therapy.
So let's just say that they're not receiving that. I just heard this podcast, and this is something that I noticed that I have been dealing with as a parent, and I have not gone to any other doctors just besides my the baby pediatrician, right? We have not had any other referrals. Can I pick up the phone and call you all and make an appointment, and you all do the assessment? Or does someone need to go to someplace else first?
Nope, they can call our office, 803-995-6737. And at that time, we will do an assessment on the child just to make sure there's not any serious underlying causes. If it's not, we'll adjust them.
What can you tell from doing that, when you do that check? What are you able to tell if someone brings their baby in because of that issue? I love that specific example, Dr. Rob, that you gave. What are you able to check?
If their reflexes are not,
if they're diminished reflexes,
their muscle tone is low.
Absolutely.
And what would that mean? What does that mean? That means it's something that they're out of alignment or something, or what does that mean?
So think about when you have two grandbabies now, right? When you hold your grandchildren, normally what happens when you pick them up, they wrap their legs around you, or you feel the tautness of their legs. Typically, if you pick a child up and their feet and their low muscle tone and their feet dangle like that, or that's an issue. Or their arms kind of flop, then that's going to be low muscle tone. It could be something neurological. So there are a lot of things that people don't know because they don't know that that's an indicator for any.
Right.
But
So and
from them
what type of therapy would you all be doing with them? Would y'all be adjusting with them? No.
we would adjust them, but as far as the therapy, we would refer them out.
Yeah, we would have to have them go with the pediatric physical therapy
therapist
and occupational therapy because
So
that's
you would be able to determine whether it's neurological or muscular. Is that right? Is that what you're saying?
Yeah, even if they needed to be referred out to pediatric neurologists, we've had to do that.
we still see them. We still
I was about to say, but sounds like they still need to keep coming because of the many benefits of
Yeah.
chiropractic care for children. Okay.
Yeah.
So let me tell a quick story.
Okay.
A baby, gosh, I can't remember how old she is now, but she came to us as a referral. Was it a referral? Yeah, it was a referral. And she couldn't turn her head one way. Mom noticed she couldn't lift her arm up. The child would be uncomfortable.
About how old was this child? You remember?
About 11, 12 months.
Okay. Uh-huh.
And wasn't crawling, wasn't pulling up.
Uh-huh.
I believe sitting up, some assisted sitting up.
Uh-huh.
When I got the child in, and again, as a licensed physician, you have to do your due diligence.
Right.
Everybody that comes into our office doesn't need to be adjusted.
Right.
And so that will cause the patient or myself harm because then we could be blamed for something that it's definitely not our doing. But got the child in, and it was my recommendation because, again, she had been put under the rug for a year, taking her to the pediatrician. My baby, something's wrong with my baby. Oh, there's nothing wrong. Took the child. This child needs an MRI. Got the MRI. There was a serious issue going on with the child. The child referred out to pediatric, orthopedic. I actually had to see an orthopedic doctor. And guess what? Baby is walking.
Wow. Wow.
But again, sometimes it's something so subtle as getting some imaging done, and pediatricians find it necessary because they feel like, give it a little more time, or that may be just that child. It's not wrong with going a step further and saying, you know what, go and check just to make sure. And when I did orthopedic tests on that baby, I was like, this is not a chiropractic case at the moment. Can I help you later? Now I adjusted her hips, and the hip issue, that was fine. But as I began to go closer up to her neck, I realized this child has been injured. So then I began to ask the mom questions. Hey, has her siblings ever pulled her on her arm? Or has she ever fallen off the bed?
Wow.
Absolutely not. So come to find out, the child had calcification of a muscle. So if you're 11, 12 months old, you shouldn't have calcification of anything at all. So that lets
what's calcification?
Calcification.
Thank you. Thank you.
It hardens, due to
what is it? Say that again.
Hardens. It becomes hard. So her muscle had calcified due to an injury. So that's how it healed.
Wow.
But as a result of how she healed, it caused her so much pain.
And you all were able to figure this out and send her to
by way of the Holy Spirit. I'm gonna be honest.
Yeah.
And a lot of what we learned, but 100% is being led. I'm be honest.
Listen, and that's why I appreciate you all. It's nothing like having some good anointed doctors. I'm telling you, I'm so telling you. And I'm going to say this, and this is not just because y'all are my friends. You all are hands down the best chiropractors ever.
Thank you.
That's my opinion, and I'm standing by it. Hands down. When I've seen, like I told you all, several. And so, audience, if you are not, I have not, Christina said, and is, I stand by that. And you all, the thing that, and I'll say this as I said in that video, you all take the time, and it's no cookie cutter with you all. It's not, I'm going to come in and I'm going to get the same exact thing. Everybody's getting the same crack. No.
Yeah.
You all take the time and you know your patients' bodies. And for children, I mean, for adults that were already nervous, I was so nervous having my first adjustment because I was like, I heard all these horror stories, but can you imagine, for a child and as delicate and as anointing as you are, I say thank you all for the job well done. Thank you. Thank you. Yeah, thank you. This is some great information. Audience, I see that. I want to say this. If you have any questions, any other questions, go ahead and put them in there. We're going to go ahead and spotlight before we go to talk about questions for yes. How often should children have their chiropractic visits? Yes, good question.
Yep, that is an amazing question. So it's case by case.
Yep.
Certainly depends upon if the child is coming in just for a chiropractic consultation and nothing really is going on. So that would be, just very mild, like mild,
Be wellness.
right?
Mhm.
Wellness every month, right?
Okay, it's like once a month or something like that.
To
That
some,
would be like routine. Like if they just say, well, you know what, based on what I've heard tonight,
yes.
I want to go ahead and start getting my child some chiropractic visits to make, because of the benefits of immune and sleep. How often would you say if I said that my child is a year old?
I would say monthly, especially in the earlier years of life, because they're hitting so many developmental milestones. Now, once
Mhm.
they become one, we could push them off, a little bit every 8 weeks,
Uh-huh.
then
Uh-huh.
because they're doing a little bit more, they're a little bit more feistier at that time.
Uh-huh. Uh-huh.
Inside your head, like, what are you about to do?
Yeah.
When they're babies, they just kind of sit there and laugh and smile. But when they get one, oh man,
Yeah.
about 18 months, they side eyeing us.
Yeah.
Um, So it's case by case, all the way up to a severe case where the child may need to come in, on a weekly basis. It just
Uh-huh.
depends on what is going on with the child. It is a case by case recommendation.
That is so good. I
Mhm.
want to say that Michelle says, how are these professional and anointed doctors getting the word out to the public of all these wonderful and needed services that they offer? Their website, you all, their website here at Life Expressions, HWC, www.lifeexpressions.com. Their phone number is 803-995-6737. Thank you, Michelle. She said, I did not know that they offer so much. Lou said, yes. Oh, Lord, this Lou said, yes, yes. This is some really good information. All right. You all, July is Juvenile Arthritis Awareness Month. And I think one of the docs told me that JIA is the acronym for it. I'm not going to attempt to say the I word. I'm going to let them do that. Okay. What is juvenile arthritis and what is that I? Let you all let them JIA. What is it? I didn't even know that it existed, juvenile arthritis. Did not know that it existed. Tell us a little bit about that. Have you ever heard? Anyone else? Have you ever heard of juvenile arthritis? Anyone else? Is it just me? Has anyone else ever heard of juvenile arthritis? Let me know in the comments. Let me know. Juvenile arthritis. All right, you all tell us, what is juvenile arthritis?
So juvenile arthritis, or JIA, which stands for juvenile idiopathic arthritis. Idiopathic, or idio, is unknown. So the cause of
Mm.
it is an autoimmune disease. Auto is self-immune, where the immune system will attack the synovium. What is the synovium? It is going to be the joints, the fluid that lines the joints will be
Mhm.
inflamed. So it is the childhood form of a rheumatoid
Yes, it
arthritis.
is.
Wow. Okay. Wow. And so how is this, how is it detected?
Yeah.
And like, are there a lot of cases of it now? Michelle said, yes, you've heard of it, Michelle. Okay. How did you hear about that, Michelle? I've never heard of juvenile arthritis. So is it, how is that detected? And is there a lot of like cases, or is that something that maybe was previous? How are we looking with that now?
Well, I think initially parents may not know what's going on with the child other than them complaining of pain in the joints, crying, severe pain, fever, inflammation.
Yeah, because what you're saying, this is not like anything
Yeah,
physical where I can see like a bone, bro, or see
yeah,
something. This is all internal when you're saying juvenile arthritis. It is all what you're saying, like autoimmune. So it's all happening internally. Is that correct?
so the parent will take them to the pediatrician and say, hey,
Mhm.
our child has been complaining of, pain in this place or that place. They have,
Mhm.
Yeah.
we don't know what's going on. From there, the pediatrician should order an MRI, right?
Yeah, yeah.
Or should do blood work and then order MRI, and that's typically
Mhm.
diagnosed.
Yeah.
Blood
Right.
definitely. I mean, you can see arthritis, especially Well, both inflammatory and non-inflammatory, but specifically because we're talking about juvenile arthritis, which is an inflammatory arthritis, you can see the inflammation on the imaging as well. Yeah.
Okay. So when they go to have blood work, that's how it's probably blood work, MRI. That's
Yeah.
how it's going to be detected.
And
And
so
uh-huh.
markers, there are inflammatory markers and rheumatoid markers that
Okay.
you shouldn't have them, right? No one should have those markers, but if you do, then that gives the physician a great idea of, okay, yeah.
And I guess that's where, because I read something, and I don't know if I'm explaining it right, but I saw something that said that a lot of times it's genetics, and if a child has a gene, some type of gene that I guess gets triggered or something, like there's a strong possibility that something can trigger that gene. Can you tell us something? Yeah, a little bit. I don't know if I'm saying this correctly.
Yeah, that's exactly correct. So you have genetic factors and you have environmental factors.
Mm.
What happens with the genetic factors, it can predispose you to an autoimmune inflammatory condition.
Mm-hmm.
In this case, the child can develop the juvenile idiopathic arthritis. Mm-hmm.
Wow.
Yeah.
And what is the treatment? Is there like any type of treatment for it?
I'm glad you asked that. That's a really good question. So, if you want to take it by way of Western medicine, there are going to be anti-inflammatories like non-steroidal steroids that can be so disease-modifying anti-rheumatic medication. It basically counteracts the rheumatoid factor. Absolutely.
Yeah. Now, is chiropractic care can that do anything for juvenile arthritis?
Yes. Well, if the child is in an inflammatory state, right, which we would be able to know. Yeah. Not adjust.
Honest told me that a lot. Your knee, something is inflamed. Yeah, she told me I get it all the time. Go ahead.
Not adjust the child in any inflamed areas. Okay. Now, spinal wise, because it's not really, it doesn't really affect the vertebral column as much. It could. However, if the child is in an inflamed state, we would not adjust, right? Because we don't want to trigger any more inflammatory time. We will offer stretching exercises, and then do some modalities as far as laser to counteract the inflammation. Because we do offer laser, which actually decreases inflammation and provides oxygen on a cellular level. And so now if the child is just coming in because they're having like some pain and things of that nature, and they're not in an active inflammatory process, and do what needs to be done.
This is good. This is really good. I thank you all for sharing. I did not even know that there was juvenile arthritis. And then when we saw that there was an awareness and then we were having you all on, I thought this was a great opportunity to ask you all just to talk about it some. I want to say, as we are gearing up and I'm talking to the audience, I want you all to be thinking of any last words you want to just share with the audience about chiropractic care in children. Audience, if you all thought that this was amazing, listen, tell the docs thank you, that they are amazing, as you have already done. And also, let's do hashtag children chiropractic. Okay, children chiropractic. All right. Let's do that. Children chiropractic, because this is so CCC, children chiropractic care, right? Children chiropractic care. That's it. Children chiropractic care. This was such great information. Did you all benefit from this? I know it's a lag between the different children chiropractic care. Thank you. Thank you. Excellent information. I see that they are saying. Thank you. Amazing. Yes, this was so good. This was so good. Wow. Thank you all so much. If you all think of any questions, Yes, thank you, Connie. Children chiropractic care. Hashtag, drop that in there for us, everyone. Children chiropractic care. Yes, Trina Brown said very good information. I'm learning a lot. Thank you so much. Thank you, Trina. Hashtag children chiropractic care. Awesome. Awesome. Yes. I have to go, and this is one I'm going to have to go and sort of process because there was so much good information that, and I'm going to share this out. You all share a video out. Lastly, I need the ones of you all that are on here, send our YouTube channel to 3 people. That's it. Listen, if 20 people send it to 3 people and say subscribe, that's 60 people. You all, we have our goal to reach 200 subscribers by the end of July. Okay, you all. Okay. All right. So we can do this. We can do this. All right. Are you all going to help me out? All right. So docs, hashtag children chiropractic care. What are your last words?
I would say in relation to the juvenile chiropractic, juvenile arthritis, because it is juvenile awareness month, that this is a disorder that can be in remission. Your child can heal from it with the correct medical care, diet, things of that nature. So just because we're talking about it, you don't really hear many cases because interventions have grown so much. And so it's just to be made aware. If you do have a child that have these symptoms, first and foremost, you can call us if you're in anywhere in South Carolina, Columbia, that area.
Yes.
We will promise to take care of you, your child, family, the best way that we can. But thank you so much for allowing us to share.
Good. So good.
Yeah, I would add, as it relates to the juvenile arthritis, being that it is an inflammatory process, autoimmune process, the thing that we probably would pay close attention to is how are other organs being affected, because arthritis can also affect the children's eyes, which is called uveitis. It also other organs, the lung, heart, skin. So there are issues there as well. So just getting the care for the child is going to be particularly important because it's not just joints that are involved.
Yeah.
Vital organs that can be affected from this arthritic autoimmune disorder.
Right. That is such a good. No, go ahead, Dr. Rob.
Advocate for your child.
And another thing also with juvenile arthritis, there is a very high percentage of children who have juvenile arthritis that are affected mentally.
Yes.
They have severe depression because of pain.
Yeah.
I mean, can you imagine, you're 6 years old and you're always in pain and everybody's on the soccer field and you can't get out.
Yeah.
For time, it will get to them. So there are so many aspects, not just the physical, there's mentally.
That's so good to spotlight that
all around for these children. And so I'm glad that we get to spotlight juvenile arthritis this month to bring awareness.
Absolutely.
Yes.
And don't any child, if there's any child, we've seen quadriplegic, paraplegic children who have had G-tubes and shunts and tracheostomies.
Yes.
We see
everybody.
We see everybody.
Wow. That is amazing. That is absolutely amazing. If you are here talking, it sounds like my husband's coming in here and I hope he doesn't start talking loud. Hope he remembers that we are on the podcast. Okay. I hear him coming in. Okay. Listen, I see that Tanika Huff said, thank you as always. I scheduled an appointment and she said, children chiropractic care. Yes, children chiropractic care. And Michelle said, yes, she's just noting that you all said other vital organs and that it can be healed and then mentally. Yes, I saw what Trina said. Very good information. I'm learning a lot. Thank you so much. You all, Dr. Stembridge, Dr. Rob, thank you all so much. This was great information. We appreciate you all giving us all this valuable information, important information on children and chiropractic care, and then also spotlighting juvenile arthritis for Juvenile Arthritis Awareness Month. All right, guys. Until next time, remember to light it up.
Right.
Share this video out. All right. And Dr.